Thank you very much. So before wrapping up this webinar, I would like really to thank all the speakers for their excellent presentations and for their time. And this webinar, of course, has been possible thanks to the hard work of Professor Tahan, Chair of the Education Subcommittee, and thanks to the AIM, which is a secretary within EACTAIC. Now, so this webinar was about lifetime care of patients with functional or anatomical single ventricle, and we have seen how it can be challenging to manage borderline cases and whether we should always go for a single ventricle repair or not. We have also seen the necessary palliation steps for children born with single ventricle physiology and the pathophysiology behind these staged palliations. We got an overview over the perioperative care of adult Fontan coming for non-cardiac surgery. And last but not least, we learned how to deal with the most difficult cases, which are patients with a failing Fontan circulation. So I hope that you enjoyed this webinar as much as I did. Thanks again to all the speakers and to all the attendees. And I would like to give the word to Professor Tahan, who has some important information to share with all of you. Thank you again. Have a nice evening.
Thanks so much, Professor Momeni. First of all, on behalf of Professor Patrick Waters, the President of EACTA, and my colleagues and Board of Directors, I thank all of you for attending today, and the special thanks to the very experienced and talented speakers on the faculty. Special thanks as well to Professor Momeni and Dr. van der Maaten for preparing this very interesting program, which is, you can see it is joining the experience from expert pediatric cardiac surgeon and pediatric cardiologist and the pediatric cardiac anesthesia, which is demanding. And the special thanks, as Professor Momeni said, to the staff behind the scene from AIM Group for organizing this event, and the special thanks to the provider from Multi-Learning Canada. You have to know all addressed questions, and all questions that will be answered by the faculty and will be posted on EACTAIC website. You will find on the same page for attending the webinar, the feedback form for UMS accreditation. It has been accredited to provide 2 CME hours. You have to complete it to claim your certificate. And I am delighted to announce about the upcoming events. The first one after next week on March 24 and 25 in Brussels. It will be the second EACTAIC Thoracic Masterclass organized by EACTAIC in collaboration with Université de Brussels. There are an opportunity to have discussions through 2 round tables with experts from Europe and Society of Cardiothoracic and Vascular Anesthesiology from United States. Limited seats are available. It is accredited to provide 14 CME hours. And after this, we have a fellowship seminar, the second series and the second episode in this year. And afterward, we have the annual Congress in October, so don't miss it. I wish all of you to have a lovely evening, and thanks so much for all of you for your support to EACTA. Bye-bye.